You wake up and your mouth feels like sandpaper. Your lips are cracked, your tongue is stuck to the roof of your mouth, and the first thing you reach for is that glass of water on your nightstand. It happens every single morning. Maybe you've mentioned it to your doctor and they shrugged it off as just part of getting older. Maybe you've simply accepted it as one of those things that comes with age. But here's what most people don't realize. Waking up with a dry mouth every single day is not normal aging. It is your body sending you a very specific signal about something that is happening during those 8 hours you're asleep. And in adults over 60, that signal is almost always pointing to one of 5 distinct causes, at least one of which could be seriously affecting your overall health right now without you knowing it. I'm Dr. Sarah Mitchell, and this channel is dedicated to bringing you the latest evidence-based research on senior health in a way that's actually practical and easy to use. If you haven't subscribed yet, I'd encourage you to do that now so you never miss what we're covering. Now let's get into what your dry mouth is really trying to tell you. Saliva is one of those things we take completely for granted until it's gone. Your body produces between 1 and 1.5 liters of saliva every single day. It protects your teeth, neutralizes acid, helps you swallow, fights bacteria in your mouth, and even plays a role in digestion. When that production drops significantly while you're sleeping, that's a red flag, not a minor inconvenience. And the research backs this up strongly. A 2022 study published in the journal Gerodontology found that chronic dry mouth affects up to 46% of adults over age 70, making it one of the most common oral health complaints in seniors. But here is the critical finding. That same research confirmed that in the vast majority of cases, xerostomia, which is simply the medical term for dry mouth, was a symptom of an underlying condition, not a standalone problem. So what are those underlying conditions? Let me walk you through each one, because knowing which one applies to you could genuinely change your health trajectory. The number one cause of morning dry mouth in seniors is medication. This surprises almost everyone I tell it to. Over 400 prescription and over-the-counter medications list dry mouth as a known side effect. 400. We're talking about drugs that millions of seniors take every single day. Antihistamines for allergies, diuretics for high blood pressure, antidepressants, bladder control medications, certain heart medications, and even common sleep aids. A 2020 review published in the Journal of the American Geriatric Society found that seniors taking 3 or more medications simultaneously had a 63% higher likelihood of experiencing chronic dry mouth compared to those on fewer drugs. And because the average American over 65 takes between 4 and 5 prescription medications daily, plus several supplements, this cumulative effect is enormous. If your dry mouth started around the same time you began a new prescription, that connection is almost certainly not a coincidence. Comment below right now and let me know. How many prescription medications are you currently taking? This will help me understand what our community is navigating, because this issue is far more widespread than most people realize. Now here's where things get more serious, and I want you to pay close attention to this next part. The second major cause of morning dry mouth is something that affects an estimated 39 million Americans, and research consistently shows that the majority of them have absolutely no idea they have it. We're talking about obstructive sleep apnea. When sleep apnea occurs, your airway partially or fully collapses during sleep, which forces you to breathe through your mouth instead of your nose. Nasal breathing naturally maintains moisture throughout the mouth and throat. Mouth breathing evaporates saliva rapidly, which is exactly why you wake up with that intense, uncomfortable dryness. But far more importantly, the sleep apnea itself carries serious consequences for seniors. Research published in the Journal of Clinical Sleep Medicine showed that untreated sleep apnea in adults over 60 increases the risk of stroke by 60% and the risk of significant heart disease by 40%. If you snore loudly, if your partner has ever noticed you stop breathing briefly during the night, or if you consistently wake up exhausted despite sleeping a full night, Your dry mouth may actually be the least serious symptom you should be paying attention to. Let me tell you about Margaret. She was a 68-year-old retired teacher who had been waking up with severe dry mouth for nearly 3 years. She'd tried every oral spray on the market, kept water by the bed, and cut back on caffeine. Her dentist had flagged increasing tooth decay that seemed to appear out of nowhere. When she finally came in for a thorough evaluation, we connected the dry mouth to a pattern her husband had been noticing for years, without either of them recognizing its significance. She stopped breathing briefly during sleep. Margaret was diagnosed with moderate obstructive sleep apnea. After beginning CPAP therapy with a humidifier attachment, her morning dry mouth resolved almost completely within 6 weeks. Her blood pressure readings, which had been quietly creeping upward for 2 years, also improved noticeably within 3 months. The third cause is diabetes, both diagnosed and undiagnosed. Elevated blood sugar causes the kidneys to pull fluid from tissues throughout the body in an attempt to dilute and flush out excess glucose. This creates a state of systemic dehydration, which directly reduces saliva production. A 2021 study from the National Institutes of Health found that 83% of people with poorly controlled type 2 diabetes reported frequent dry mouth as an ongoing symptom. Here's the number that should make every senior stop and think. Approximately 1 in 3 adults with diabetes in the United States is currently undiagnosed. They have the condition and don't know it. If you also experience frequent urination, unusual fatigue, blurred vision, or slow-healing cuts alongside your morning dry mouth, please prioritize a fasting blood sugar test this week. The fourth cause is chronic dehydration, and it works very differently in seniors than it does in younger adults. Here's why this matters. As we age, the sensation of thirst becomes significantly dulled. Your body can be operating at a meaningful fluid deficit and simply not send you the warning signal it used to. Research from the European Journal of Nutrition confirmed that adults over 65 are chronically underhydrated compared to younger adults, often with no sensation of thirst whatsoever. Your morning dry mouth could simply be the most visible sign of a body that has been running low on water all day long. The fifth cause is Sjogren's syndrome, an autoimmune condition that directly attacks the glands responsible for producing both saliva and tears. 9 out of 10 people diagnosed with Sjogren's are women, and the average age of diagnosis falls in the late 50s and early 60s. It is notoriously underdiagnosed because its primary symptoms, dry mouth and dry eyes, are so easily dismissed as normal aging. If your dry mouth comes paired with persistent dry, gritty eyes, unexplained joint pain, or a level of fatigue that feels out of proportion to your activity level, Sjogren's syndrome belongs on your list of things to discuss with your doctor. Here is exactly what you should do with this information. Step 1 is the medication audit. Write down every prescription medication and every supplement you take, including anything over the counter. Bring that list to your next doctor or pharmacist appointment and specifically ask, could any combination of these medications be causing or worsening dry mouth? Ask whether any drug could be adjusted in dosage, substituted for an alternative, or simply timed differently to reduce the overnight effect. This single conversation has resolved morning dry mouth for many of my patients without changing their treatment at all. Step 2 is the sleep quality assessment. For the next 7 nights, keep a small notepad by your bed. Each morning, write down whether your mouth was open or closed when you woke, whether you feel genuinely rested or still exhausted, and ask a bed partner, if possible, to listen for snoring or pauses in your breathing overnight. If you see a pattern forming, ask your primary care doctor for a sleep study referral. Many insurance plans cover sleep studies fully for patients over 60, and the test is done comfortably at home these days. Step 3 is a blood sugar check. If you haven't had a fasting glucose or HbA1c test in the past year, schedule one now. The HbA1c gives your doctor a 3-month average of your blood sugar levels. It takes less than 5 minutes and could catch a developing problem that your dry mouth has been quietly signaling for months. Step 4 is deliberate hydration. Begin drinking about 16 ounces of water spread across the 2 hours before bed, not all at once. And increase your total daily water intake to at least 64 ounces spread throughout the day. Set alarms on your phone if you need a reminder. Never wait for thirst to be your signal anymore because that system is simply not as reliable as it used to be. Step 5. For immediate overnight relief. While you investigate the root cause, look for a mouth rinse or oral gel containing xylitol. Products like Biotin Dry Mouth, Oral Rinse, or ACT Dry Mouth Rinse are available at any CVS, Walgreens, or Target. Use them right before bed each night. Xylitol also provides mild antibacterial protection for your teeth while you sleep. Avoid any mouthwash that contains alcohol, which significantly worsens dryness. One important safety note: if you are on blood thinners, ACE inhibitors, or lithium, please discuss any significant changes to your hydration habits with your doctor first, as shifts in fluid intake can affect how those medications behave in your system. And if your dry mouth is accompanied by pain, difficulty swallowing, white patches anywhere inside your mouth, or unexplained weight loss, please see your doctor promptly rather than waiting for a routine appointment. Morning dry mouth is common, but common and normal are two very different things. In most cases, it is pointing directly at something specific and identifiable. Medication, sleep apnea, blood sugar, dehydration, or an autoimmune condition. All 5 of those things can be addressed. You now know where to look and what to ask. Comment below with one of these 3 responses so our community can see where people are starting. Comment medication if you suspect your prescriptions might be involved. Comment sleep if you think breathing or sleep apnea could be the culprit, or comment getting tested if you're making a blood sugar appointment your next step. I read every single comment, and your response genuinely shapes the topics I cover next. If this video helped you understand something your doctor hasn't taken the time to explain, please subscribe so you don't miss next week's video, where we'll cover the specific warning signs that a common cholesterol medication is actually doing more harm than good in certain seniors over 60. It's a topic that generates a lot of questions and deserves a thorough, honest answer. I'm Dr. Sarah Mitchell. Take good care of yourself. You now have the information to do exactly that.